And welcome back to The Factor Uncensored. My next guest is hoping for a full recovery for Congresswoman Sheila Jackson Lee, like most of us here in this city. As we've reported, she is still battling pancreatic cancer. He joins us now with more details on the disease and what to expect. And joining us on The Factor Uncensored tonight, we have with us Dr. Danish Ali from Archpoint Pain Institute. Dr. Ali, obviously, you know what's been going on with Congresswoman Sheila Jackson Lee. Only earlier this month that we have been notified or alerted that she was given a diagnosis for pancreatic cancer. It's our understanding she's not in the hospital, but at home going through treatments there. They're not revealing a lot. And obviously, we understand this is a private family matter, even though so many people love the Congresswoman. She had a prayer vigil at Community of Faith Church just yesterday where hundreds of people turned out to pray for her. But for those who are not familiar with pancreatic cancer, exactly what is it?
Yeah, Isaiah, pancreatic cancer is an abnormal growth of cells in the pancreas. As we know, our bodies are constantly producing new cells all over the body. And what happens specifically in pancreatic cancer, there's an abnormal number of or an abnormal cells in the pancreas. And what that does is it causes the pancreas to stop working in most cases or to work abnormally. And that's why we see some of the symptoms and signs of that, because the pancreas' primary responsibility is to assist with digestion and also maintaining blood sugars levels, okay? And so when we have an abnormal working pancreas, we'll start seeing discoloration of the skin, jaundice or yellowing of the eyes and the skin, nausea, vomiting, weight loss, fever, chills. All of those are symptoms, Isaiah, of an abnormal working pancreas because of the growth that it's happening. Unfortunately, pancreatic cancer is oftentimes diagnosed advanced in its advanced form, where the treatment options may be quite limited. And I suspect that that's maybe where we're at with Miss Sheila Jackson Lee. And so my prayers and thoughts definitely go out. And it's just a very tough time for her family. And we're all praying for her currently.
And just recently, she was at your home for an event. Obviously, she's no stranger to the Ali family.
That's correct, Isaiah. We did have her over just a couple of months ago, and at that time, we spoke. She did not make any mention of any health concerns at that time, and it's, again, a very difficult time for all of us, especially for my family who knows her personally, and we're praying for her every day.
How important is it a quick diagnosis if you have pancreatic cancer? And what would be the signs before it gets to a point where there's no return?
Yeah, Isaiah, unfortunately, this cancer, especially when it presents with its signs and symptoms, it's often later in its diagnosis and it's advanced beyond some of the treatable things that we have out there. And so a lot of times this cancer may be found incidentally in its earlier stages, and those patients may be asymptomatic, meaning they may not be having any symptoms. And what happens is that they may have gone in for some sort of checkup, and that checkup led into further imaging, and then that led to that diagnosis, and they caught it pretty early. Unfortunately, when it presents with signs and symptoms, and you see the weight loss, you see the yellowing of the eyes or the skin, the nausea, the vomiting, those sorts of things, it's often too late, and it's often a diagnosis where it's spread to either the other parts of the body or it has advanced in its growth pattern as well.
Are there any that you know of experimental treatments out there that they may use in the case of pancreatic cancer that could help?
Yes, Isaiah, there are. There are a bunch of clinical studies going on right now. And they're happening all over the country. We're fortunate in this state to have the Texas Medical Center, have MD Anderson, one of the most advanced cancer facilities in the country. And so I'm quite optimistic that, if possible, they will definitely be offering all the treatment options possible for Sheila Jackson Lee.